Welcome back to You Heard It Here with Dr. Gary. Today, my assistant Bailey and I are going to talk to you about what to expect when coming in for a hearing test. Believe it or not, this is one of the most commonly asked questions on the phone. People just don't seem to know what to expect. They don't know what they're getting into prior to coming in, so we like to give them a really good expectation. There are a lot of different parts of a hearing test that can be done, but there are some essentials that must be done. So let's go over these. First, when you start the appointment, you and your hearing healthcare provider, I don't care if it's a hearing instrument specialist, an audiologist, an ear, nose, and throat doctor, you should be going over your medical history. Do you have any comorbidities that are concerning for hearing loss? Are you a diabetic? Do you have high blood pressure? Have you ever been diagnosed with cancer? All of these questions are really important. Once your medical history has been established, the next question is always, what is your symptoms? What are you going through? Are you having difficulty in noisy situations? Are you asking people to repeat? Is the TV too loud? Finally, what's your motivation for being in the office today? Is it because you're fill in the blank? Husband, wife, son, daughter, neighbor thinks that you can't hear and is frustrated with you? Or are you really noticing a difference? It's really important that your hearing healthcare provider understands your medical history as well as what you're going through and your motivations for being there. Once you go through the medical history, the next step is to have your hearing healthcare provider look in your ears. It doesn't matter if they do it through a video system or if they do it through a handheld otoscope, but if they're not looking in your ears, you need to just stop. Don't let them proceed with the test, because unfortunately, if we don't look in your ears, I have no way of knowing if you're impacted with earwax. If you're completely impacted with earwax, we're not going to get accurate readings. So now that we've looked in your ears, we've gone over your medical history, the next step is to do a tympanogram. Make sure that the eardrum is moving properly. The reason this is important is if your eardrum is not moving, we're expecting to see certain types of conductive components, and that can change our recommendations as we go through. After we do a tympanogram, we always do acoustic reflexes. Acoustic reflexes send a loud sound into the ear and they track the contraction of the muscles in the middle ear after the feedback loop as the sound goes up through the auditory nerve and the lower brainstem. We're just checking the health of the overall system through a tympanogram and acoustic reflexes. Following the tymp and reflexes, we then like to do a pure tone audiogram. This is the one everybody's familiar with. Push the button when you hear the beep, even if it's really soft, even if you're not sure. This can be done with a steady state tone or a pulse tone. There's not really a wrong way. It's all about preference. If you are experiencing tinnitus or ringing in the ears, please make sure to tell your hearing healthcare provider about that. Ask them to do a tinnitus matching. This is not something that's appropriate for everybody, but again, it is important to know what is the pitch and intensity or the frequency and intensity of your tinnitus. After pure tone audiometric testing is done, we then like to go on to speech testing. There's two different speech tests that, in my opinion, are mandatory. The first one is a speech reception threshold. This basically means you're going to hear words such as baseball, ice cream, cowboy. They're going to get softer and softer. It's your job to repeat them. If you're not sure, make sure that you guess. The next one is a word recognition test. Now, word recognition testing stays at a comfortable volume. You're going to hear a recorded voice or possibly a monitored live voice of the phrase, say the word dog, for instance. Not you, Bailey. Not you. Say the word dog. Your job is to then repeat dog. Again, it's really important that you take a guess, because when you guess, it lets us really look at the auditory system and how well your brain is processing the sounds without visual or contextual clues. Depending on your symptoms and what you are reporting, we may or may not do a speech and noise test. Again, that's not really a mandatory part of the test, but it is something that is great for information, especially if you're reporting difficulty in noisy environments. Right, Bailey? The last test that is a must is bone conduction. For this test, either a bone oscillator is put behind the ear or on your forehead. It really depends on how the setup is. You're then asked to indicate that you hear the beeps, and this eliminates the outer and middle ear. Again, remember back to when we did the tympanometric testing, checking if the eardrum's moving, we want to make sure that that middle ear is healthy. Well, this establishes a hearing threshold by skipping the middle ear. Those are the parts and the order in which we do the test. Now, I've been to offices where they will do a tympanogram at the end, or they'll do bone conduction before they do speech testing, or they'll do speech testing before they do pure tone testing. The order is really irrelevant as long as all parts of the test are being done and your hearing healthcare provider is looking in your ears prior to you being tested. So, let's summarize. Let's go back through this. First, when you come in, go over the medical history, your symptoms. Then move on to looking in the ears. If they're not looking in your ears, that's a major red flag and a big concern in my book. Third, some order of these tests, a tympanogram, making sure the eardrum moves, pure tone testing, speech testing, and bone conduction. That's the basics of an audiogram. After that, there are other tests that you can do, really depending on your individual situation. Get your hearing tested today. There's nearly 30 million Americans, that's 60 million ears, suffering from hearing loss. So many of them go untested. The sooner you test and treat your hearing issues, the better you're going to be. I hope you've enjoyed this video. This has been You Heard It Here with Dr. Gary. Please like and subscribe. And if you have any questions or comments, please leave them in the comments section below. Thanks for watching.